South London is an area of huge contrast. There are pockets of extreme deprivation, high levels of homelessness, and a range of other social problems, different forms of discrimination. On the other hand, there are areas that are relatively well off. So what that can create is, on the one hand, high levels of stress, mental and physical ill health among some communities, especially people who may have multiple morbidities. And there's now a lot of evidence of the kinds of effects of the physical as well as social environment and how that can undermine or help people's health.
Well, one of the big health problems in infection is how to diagnose an infection really fast. And the way that we approached this early on in the Clark was looking at diagnosing respiratory infections, particularly flu. The issue that you have is if you make the wrong choice with an infection, you can actually have big knock-on effects for patients, and these can be very vulnerable. One of the best ways of dealing with that is to find out really what's happening with patients, and exciting new technologies are coming out that can make the diagnosis within 20 to 30 minutes. But the real question is, can you do it in a real hospital, and how do you do it to have a real impact on patients?
Because I hadn't realised that people with psychosis want to pack up smoking. I thought that people who smoke just wanted to smoke, but the fact that once they're in hospital they actually want to stop smoking and they have the resources and the support to stop smoking is excellent.
By involving service users, patients, carers and local communities, researchers can help to shape their research in ways that develop new knowledge and put that into practice to improve health locally and beyond.